Today I want to talk to you about floaters in the eye. At some point, almost everyone is going to experience floaters. They're very common. I'd like to show you on this model where they are and what they are. Inside the eye, right behind the iris, the color part, the next structure back is called the crystalline lens, and then behind it is called the vitreous humor. When we're young, it is a gel-like substance, but as we get older, it begins to break down and liquefy. And these collagen fibers in the vitreous clump together and form a floater. Now you have to have light from the outside entering your eye. That light hits the floater and then it casts a shadow onto the retina. I've had floaters for years. Mine look like a string of bacteria. Other people will describe them as gnats or spider web. Now the floaters in and of themselves are an annoyance. The serious part is that this vitreous has some adhesions to the retina, and in rare occasions it can pull away from the retina and cause a hole or a tear or detachment. That's a serious problem. So when patients are experiencing floaters, we typically will bring them in, dilate the pupils, take a good look in the back to make sure there's no retinal problems. With time, the floaters will either settle down out of the visual axis or, quite honestly, you get used to seeing them. But they're really very common. The most common cause of floaters is birthdays. You're going to see them more in older people than younger people. But also people who are real nearsighted will experience floaters earlier in life. And even people who, after they've had cataract surgery, are going to notice floaters more frequently. Again, if you're experiencing floaters, please call our office. We'll get you worked in and we'll dilate your pupils and make sure everything's okay.